There's no evidence healthy kids need it today, and most countries have stopped recommending it for children.
A major shift from Health and Human Services Secretary Robert F. Kennedy Jr. He says the U.S. will no longer recommend COVID shots for healthy children and pregnant women. That announcement was made this morning. But the question that a lot of people have tonight is, will we still be able to get the COVID vaccine this fall if you still want it? Our Michael Rosenfeld is joining us live tonight. Michael, good evening to you. You spent your evening tonight talking with doctors. How are they reacting to this news tonight?
Well, Colton, it looks like fewer people will eventually qualify for the COVID vaccine. Tonight, we spoke with 2 local doctors to get their thoughts and expertise on today's announcement.
Hi, everybody. I'm Robert F. Kennedy Jr.
U.S. Health Secretary Robert F. Kennedy Jr. announcing Tuesday that the COVID vaccine will no longer be recommended for healthy children and for healthy pregnant women. He posted this video on social media alongside the Commissioner of the Food and Drug Administration and the Director of the National Institutes of Health.
There's no evidence healthy kids need it today, and most countries have stopped recommending it for children.
We're now one step closer to realizing President Trump's promise to make America healthy again.
Dr. Ofer Levy, director of the Precision Vaccines Program at Boston Children's Hospital, says he would have liked to see the traditional scientific review process play out before any decisions were made.
These are complicated topics. In my mind, all the more reason to have convened a committee to discuss this.
He says it'll likely be harder for parents to get their children vaccinated and for pregnant women to get the shot because it likely won't be covered by insurance. He says the COVID vaccine may soon be only recommended for people 65 and older and those with chronic disease or are immunocompromised.
Folks who don't fall into the preferred category for receiving the vaccine might find themselves, for example, having to pay quite a bit out of pocket to receive the vaccine.
I have seen quite a few pregnant women seriously ill with COVID-19.
Dr. Shira Daron, Chief Infection Control Officer at Tufts Medicine, says there likely should be a reduction in the overall number of people getting COVID shots, but pregnant women should be considered immunocompromised. She says as a whole, there's been a series of mixed messages from the government about vaccine eligibility going forward.
Now we have sort of 3 different messages going around about who should get the vaccine, and there's no way now to avoid complete and utter confusion.
So right now, if you want a COVID vaccine booster, you can pretty much go out and get one. Insurance will likely cover it, but how long that will last exactly is still unknown. Live in Boston tonight, Michael Rosenfeld, NBC 10 Boston.